Welcome to the What If It's Not Depression podcast. I'm your host, Dr. Achina Stein. And today we are going to be talking about integrative dentistry. I have on my show today, Dr. Michelle Jorgensen. Dr. Michelle Jorgensen is an author, speaker, and health-based dentist. She's written 5 books and runs an education center for living well. After practicing traditional dentistry for 10 years, she became ill from drilling out mercury fillings. Her own healing journey led to her create the Total Care Way, which is an answer to chronic disease. Patients from around the world seek her out, and she has received certifications as a therapeutic nutritional counselor and is a traditional naturopath. A busy mom of 4, she loves to spend time with her family, and she is happiest when teaching and helping people. Welcome to my show, Dr. Jorgensen. And if you like this episode, please click the like button and subscribe.
Thank you. Thank you for having me here.
Oh, it's great having you here. I've been wanting to have a dentist on my show, especially a person who's been through the journey that you've been through, and really turning things around and approaching dentistry in a completely different fashion. I'd love for you to just start with your story because I think it's pretty amazing, and let us know how it is that you got into what you do today.
Yeah. So I started as a traditional dentist. I come from a dentist family. My dad's a dentist. I have 3 brothers that are dentists. So that's just what we do. And I love dentistry. I was really immersed in learning about new things, continuing education, becoming, the best I could be. And that's what I thought dentistry was all about. It's just becoming a great practitioner, taking great care of patients. And I was loving it. About 10 years in, I started having major health issues. And a lot of that people chalk up to, oh, I'm getting older, or I've had children, or, you always find an excuse or a reason for it. I was having gut issues, which I'm learning as I've studied a lot about gut health. That's not unusual. About 50% of us do have some sort of gut problem. So I thought that was just what happens. I started having memory problems, which was an interesting twist because I've always had a very good memory. And I couldn't remember a patient's name from room to room. So I knew something was wrong because that's not how I've been in the past. But the big one that really was life altering is I had such numbness in my hands that I couldn't hold a dental instrument anymore.
Wow.
And you can't actually be a dentist unless you can do the work. so I had my practice for sale, and I was looking at every potential reason that this could happen. I had been to every doctor there was. This is the common story. You've been everywhere, every test, every x-ray, everything, and no answers. So I had the practice for sale, and I was trying to figure out what I was going to do with the rest of my life. I was in, my mid-30s, and my husband also worked for the practice. So this was our entire livelihood was now looking at going away. So it was a very scary time for us. And, not only could I not hold a dental instrument, but I couldn't brush my teeth without my hand going numb. I couldn't blow dry my hair. I couldn't sleep at night. I was up all night long with hands that were just in pain. And it was really altering my life and what I was able to do. So finally, I spoke to a practitioner, a dentist, who said, "You sound just like me. Have you looked into mercury poisoning at all?" And nobody had even introduced that idea. And I said, "Well, no, I don't have any mercury fillings. I don't have any, silver or amalgam fillings. That's what we call them. I don't have any of those." And he said, "Oh, no, it's not the fillings you have. It's the fillings you've been drilling out for the last 10 years without any protection." Well, I'd never been told that that was a problem. I'd never been told that dentists could be a risk, that dental assistants could be a risk, that anybody could be at risk. All we were told in school about mercury is that it's perfectly stable, it's safe, and if you talk about it and tell anybody that it could make them sick, you will lose your license. So you've now had the dental school talk about mercury. That's what we learned. And they still learn it today. It hasn't changed. So that's all I knew. I thought, well, it's worth a try. So I got tested, and mercury toxicity off the charts. So all of a sudden, all of my symptoms made sense because mercury is a neurotoxin. So this is why it ties in so much with depression and all the things that you speak about, because mercury is a neurotoxin and it affects the brain heavily and it embeds in the brain. So my numbness now is making sense. My memory issues, brain fog, all these other issues are making sense. Gut issues. So mercury actually interferes with the formation of stomach acid. So when you have mercury, you're not forming stomach acid, you're not digesting food properly. All of a sudden, nothing's working in the gut either. So all my systems made sense as soon as I found out what the root cause of this was.
Right.
And as I found that out, doctors said, all right, you can't get better if you're going to keep drilling out fillings and breathing it in. So you've got to figure out, can you do this job still? So I had to go and find, were there ways to do this? And
Right.
I found that there was an entire organization around it, had no clue they even existed,
Right.
and went and learned their protocols, started implementing their protocols in my practice for safe mercury removal. So a lot of things we do along with that removal process. And it was for me. Like
Right.
that was just simply for me, so I could keep practicing. And then I started thinking, well, this is going to be good for my dental assistants too. This is going to be good for my receptionists too. They're all breathing this in. We're all in the same office. And then I started thinking, well, heavens, this is going to be good for my patients. They shouldn't be breathing that in when I'm drilling these fillings out either. And patients started noticing, asking questions, what are you doing? Why are you doing this? And so that's how I explained it. And then they started saying, well, my doctor's looking for someone who can do this. Can I send, tell them about you? Sure. And I was a little nervous at first because I didn't know much myself. I was kind of at the beginning, and oftentimes I find that other practitioners outside of dentistry know more about this than dentists do. So I was a little nervous. I had to, study up myself and find out how it all worked. And then the doctor started saying, well, if you do this, do you do this as well? And they started asking questions. I'd have to go study some more, take some obscure class somewhere, and learn about it. And then I could say, yes, I do that too. And it really has transformed my practice into one that's health-based and focused on the overall health of the patient, not just the mouth, what root causes are as far as what we're seeing in the mouth, but also what we're seeing in the mouth, what it could be a root cause for in the rest of the body.
Right.
And it's been a journey that I never expected to be on, but I'm a researcher. I'm just kind of a studier. I want to find answers to questions. That's just kind of who I am at heart. And so I've just dived into this, head first, and had been amazed to find out what really the responsibility that we as dentists have that we're not fulfilling. We're not fulfilling for patients. So that's what I like to teach people about now.
Yeah, I totally agree with you. That's also the case for psychiatrists and all the other physicians that practice in the traditional fashion. You don't realize until you're actually in it that that there's this whole world out there that operates in a different way and addresses other issues. And it's just a shame that we're not practicing globally and doing the same thing. And it's really amazing how much I have learned being a functional medicine psychiatrist and all the things that I never knew about until I dove into it like you have. And that's fantastic. Yeah, that's an amazing story. So how are you now in terms of the numbness in your hands and your memory? How's that been?
The interesting thing is the numbness took a while. It took a few years even to dissipate. And so I worked hard at it. I worked hard at the detox. Memory, I remember the day when I looked at a patient chart and I remembered everything about them. And I went, it's back. It's back. At least mostly it's back. It's so
Yeah.
nice. The
Yes.
one piece that's still a bit of a challenge is the gut issues.
Mm.
And I have been doing a very intense detox now. I have another few months left on it. And I've been revisiting a lot of those symptoms. Some of these things have been coming back up again. Some of the numbness, some of the brain fog has been coming back. And what I'm realizing is that mercury it's a bad guy. It's a bad dude, man. And it hides. And so even though I went through all that detox and I'm so careful now about staying away from it and everything else, I still have some. And so I'm doing a really intense detox now that I'm hoping will get all the rest of that out. So this is one of the reasons I love to talk with people about it as well, as it's so difficult to get rid of it that let's just not put it in and let's do it safely when you're getting, I really don't want to get it into the body because it's so difficult to get out of the body.
Right. So can you talk about more about what functional integrative dentistry is? I mean, I think you mentioned pieces of it, but how do you approach it from the very beginning with a new patient?
So my new patient appointments are very different than probably the ones you're used to in the dental office.
Mhm.
Typical dental visits is, and most of you're gonna definitely relate to this. You go to the dental office, they take X-rays, they clean your teeth. The dentist pops in for a few minutes, checks those X-rays, pokes around at a few things, says, "Oh, you have a couple of cavities. So we'll see you again in a couple weeks." They leave. They schedule you for the cavities. You come back, you get them fixed, and you leave, and you do it all again 6 months from now, right?
Exactly.
That's our
Exactly.
dental experience. So, in my mind, and thinking about this, I'm thinking, wow, we just lost a lot of opportunity.
Mm,
First of all, we didn't look at a lot of the things that we can actually see in the mouth. We can see so much that's reflective of what's going on in the body. So that short little cursory exam doesn't give us the opportunity to see what we can. Mouth is really a display of what's happening elsewhere. And people are shocked every single day. I'll point things out. I'll say, just the other day, I said to a patient, I said, "I think you fell and hit your chin, probably right over here, maybe when you were around 2 or something." She's like, "I have a scar right here. How did you know that?" And I said, "Oh, because you have joint degeneration and it's developmental." And, she's just like, "I don't know how you can figure these things out."
mhm,
But we look a lot deeper.
mhm,
So what functional medicine is, and this is your world,
mhm.
functional medicine is looking at the root cause. So when you're talking about the typical dental visit, they tell you you have a cavity. Well, did
Right.
anyone talk about why?
Right. Exactly.
Why you
Exactly.
had that cavity, or how you could prevent the cavity, another cavity in the future, or what does that cavity actually mean? What is that a sign of? Maybe is there a sign of something else that's not working right in the body? So that's root cause, saying, okay, what is the actual source for the symptom that we see? And a cavity is a symptom. All these things are just symptoms. So what's the source of that? That's functional medicine.
Mhm.
And that's definitely fits what we do. But I also tag on the integrative piece, because integrative medicine, what integrative does is they bring in good things from every modality. So good things from alternative care, good things from traditional, modern medicine. And
Mhm.
I believe there's good to be found everywhere. And we
Right.
don't have to set up lines on opposite sides and shoot arrows at each other.
Right.
That's not helpful. We need to say, okay, this actually is such a great advancement. I'm so glad that we've learned this in the last 100 years or 5 years, however long. And this is amazing information that our grandmothers have been using for decades and centuries. And wow, that makes sense because that fits with what we just learned through science. We
Right.
don't have to pick one or the other. We can utilize chiropractic work and osteopathic work like you do.
Mhm.
And we use functional medicine practitioners and
Right.
massage therapists and lactation consultants. Like, we use all of these. And so that's integrative
Right.
medicine, or integrative dentistry, is incorporating everything good into a complete plan for the body. So functional, root cause, integrative, using everything good that we have. So
Right.
that's why I call myself a functional integrative dentist, because we use
Oh,
everything.
yes.
And to
Well,
answer the question,
I would say that I practice exactly the same way as you do
yep,
too. I
yep,
mean, we're
exactly.
just expanding our toolkit and using the best of all the worlds,
Yep,
and osteopathy, traditional medications, for
yep,
when they're needed, but while they're being used to figure out, well, why did these things happen, and really using the best of all the modalities for individually picked for that person that's suffering. Yeah, I completely agree with you. So talk a little bit about why dental problems lead to chronic health problems. I think people need to understand that this is not an isolated, this area is not, sort of like in this tower away from the rest of the body, that it's intimately connected to the body. And I think it's difficult for people to understand how it is that dental problems could lead to heart problems, let's say, or could lead to depression or dementia. I would help everyone to connect the dots.
yep.
Yeah.
Interesting. There was a book written, I believe it was about 2017, and it's one of my favorite books because it was written by a man who's an MD.
Hmm.
So, he's been traditionally trained in medicine, but also, is incorporating other things. But he's also a JD. And those who don't know, that's a lawyer.
Hmm.
So the reason I love this book is because I know he's not going to say anything that he can't back by science,
Hmm.
because he's a lawyer. So he's going to be careful. If that makes sense.
Yes.
The book is called The Hidden Epidemic, and it is all about dentistry. So this is a doctor talking about dentistry. And in that book, he says that 60 to 80% of chronic disease can either be caused by or contributed to through dentistry. So something that's going on here can either cause or contribute to your chronic disease in 60 to 80% of people. That's enormous. So how does that work? Well, in my practice, there's three pillars that we talk about. The first one is infection. There are 3 places in the mouth that infection can hide. And people will say, well, gosh, wouldn't it have hurt? Shouldn't I have known that this is going on? A lot of times, no. A lot of times there are not physical symptoms that you're feeling. I can see it, but you can't. So the three that you see, or that we see often, number one is gum disease. About 70% of Americans have this infection. And anytime you have an infection anywhere in the body, it's going to ask a lot of the immune system. This is the key point to make with infection anywhere. It's going to ask your immune system to be on guard and to be fighting it 24/7. Well, with any soldiers, if you ask them to be alert 24/7, they're going to get fatigued, right?
Right.
Not only that, but they're busy. So if some other enemy starts to attack from another front, well, they're already busy over here. They're not even going to notice this guy's coming in, or they're not going to have the strength to go fight it. So that's any infection in the body that's long-term chronic is going to decrease your immune strength, distract your immune system, and make it less capable of dealing with other things that come.
Right.
So gum disease is one. 70% of you have it. You need to find out if this is something you have that your body's fighting. Does it hurt? No. It's often what we call the silent, deadly killer of teeth. It'll take your teeth out and it'll kill you before you often will even know it's happening. Number 2 is root canals. This is a huge area of controversy. And I'll straight up say, I think the reason it's a huge area of controversy is because there's a lot of money to be made in root canals. There are about 28 million done in the United States per year. So this is not a small industry, and a root canal does a good thing in the start. It saves a tooth. A root canal saves a tooth. Unfortunately, root canals, the inside of a tooth can never be completely cleaned. It's impossible. So there always is going to be dead tissue, and dead tissue attracts bugs.
Right.
So no matter what, any root canal in the mouth is going to have a low dose chronic infection somewhere in that tooth structure. Again, it's just asking your body to deal with a lot. We find these on CT scans, dental specific CT scans. And now that I use a dental specific CT scan for every new patient, we run them through this and I read the CT scan on every new patient. I probably find 15 failed root canals per day.
Wow.
Massive abscesses, not little ones, massive, like quarter size holes in jawbones due to these infections, and they don't feel them at all.
Wow.
Or sinuses that have been completely destroyed and filled with infection. No idea. It's a leaking, failing root canal. So that's the second area of infection. And the third area is where you had a tooth removed. And a lot of people say, I have all my teeth. Do you? Do you have your wisdom teeth still? How many people have wisdom teeth removed?
Right.
90% of us.
Right.
So a lot of times those areas didn't heal properly, and infection or dead tissue stays there because they don't heal. And then again, bacteria and viruses and parasites and everything find that dead tissue. And it's just this low grade, low dose infection, huge correlate to endocrine system. So fatigue, energy systems, all of that, as well as heart and stomach. So anybody who's having any of those issues, I say, go have your wisdom teeth checked. Again, you need that CT scan. So that's a big long talk to say that's evil number 1 is infection. All those things could be living in your mouth and causing so many downstream health effects. Second one is metals. I already talked to you about my issue with mercury. How close is your tooth to your brain?
Really close.
2 inches or so. So that mercury does travel from your mouth to your brain very easily. It crosses the blood-brain barrier. And not only that, but it creates a small electric charge. The metals in the mouth create a small little battery going on in the mouth. Again, this small little battery drains your battery up here, drains your brain. So mercury in the mouth is very detrimental to health overall. This has been proven. I won't lose my license now to tell you this. There's evidence that proves that mercury is dangerous. It's the most neurotoxic element on the planet. So you shouldn't have it in your mouth, period. But I'll always tell people, don't have it removed unless it's removed safely, or you're just going to get a whole bunch more.
Absolutely.
So that's evil number 2. Evil number 3 is sleep. This is one that people don't often think about, but how many people in the world are suffering from sleep issues?
Lots.
About 60%.
Mhm.
Yep. And it's often due to an infection in the mouth, which is causing swelling and you can't breathe by it,
Mhm.
metals in the mouth, which is causing swelling and you can't breathe by it, or structural changes in the mouth. Just
Mhm.
you have a small mouth. They took out teeth for braces. There's a lot of different things. And so dentistry has the ability to look and say, what's happening here from a sleep standpoint? Is it a structural problem? And if so, we have ways to fix that.
Mhm.
So that's a lot of talk to say dentistry has a lot to do with your health. Infection, metals, and breathing are the big three.
Right, right.
Huge,
Wow.
huge.
Yeah. So, sometimes, I wonder what the options are for a root canal if there's high risk of, long-term problems with getting a root canal. Can you talk about that?
Yeah, we have a lot of patients that come for a second opinion for root canals. So
Mm,
they've been to another dentist and they've been told you need a root canal. Well, first of all, that's an improper statement. You never need a root canal.
mhm,
There's no need. You will not die without a root canal. So first of all, you don't need a root canal. The tooth may already be dead, and that may be an option for your tooth, but you don't
right,
need one.
mhm,
So I like to just diffuse that myth right off the bat. Nobody needs a root canal.
right.
Um, but they've been told you need a root canal. So the differential is if the tooth is still alive,
Mhm,
meaning does it still hurt? Is it still sensitive? Is there, something that you can feel on the tooth? Then what we do is try our absolute best to save that tooth. And research has really progressed in dentistry on this in this area where we are able to patch deep cavity areas. We're able to patch over nerves. We're able to save teeth and keep them alive. So
mm,
that is our first line of defense is if the tooth is still alive, we will desperately try to keep it that way. Keep it
mhm,
that way, keep it in the mouth, keep it healthy. That's that's option number one. If the tooth is already dead. So if you already have a swollen face, you already have, the tooth is already gone, then at that point, there isn't another option other than removing the tooth.
mm,
Nobody likes to hear that.
right.
But I will tell people, I used to do anything. I used to save a tooth at any cost. Now I'm
Mhm,
going to save your health at any cost, even if it means losing a tooth, because I can replace your tooth. I have ceramic dental implants now. It's totally porcelain top to bottom. I don't have to introduce any metal. I can replace your tooth all day long, but I can't replace the health that it's going to take from you if that tooth has a root canal and it's a chronic low dose infection for 30 years.
mhm,
I can't replace that, but I can replace your tooth.
right. Yeah. So what you replace it with a ceramic, what did you call it? Ceramic
Ceramic dental implant.
dental implant. Okay. So implants, now my understanding is that also that implants can also be problematic. Is this a different type of implant than what's traditionally used?
Yep, the large majority of implants done are titanium. The
Okay.
problem with titanium is again, battery, electric charge, brain's 2 inches away. You
Mhm.
know all about brains. So you don't want to be draining your brain from an electrical charge going on with metal in your mouth. There's other issues with titanium as well. Titanium is in so many things now. It's in most cosmetics. It's in sunscreens. It's the hard candy coating on the outside of M&Ms and
Mm,
Skittles. You know that? That's made of
yes.
titanium.
Yes.
So basically what's happening is we're just getting way too much of it. And so a lot of people are becoming sensitive to titanium, not allergic. It's not an allergy, it's a sensitivity, it's an overload. There's just too much of it. So we plug another huge chunk of it in your mouth or in your hip or in your shoulder or, something else surgically, and it's too much for the body to handle. And all of a sudden the body becomes sensitive to everything, chemically sensitive, food sensitive, and you think, what just happened? Your
Right.
body's overloaded, it can't deal with anything anymore.
Well, it's a foreign body, essentially.
Yep,
Being
you
put
can't
in,
deal with it.
yeah, and the body's rejecting it like it would with anything that doesn't belong in the body. Yeah.
Yep.
So I've asked this question of many dentists and I've not gotten an answer, and I'm curious to know what your answer is to this. What is the cause of the gums changing color? Darkened or lightened, and is that a symptom of gum disease? You mentioned a pretty high percentage of people actually have gum disease and don't know it. Is that one of the symptoms?
Well, there's natural melanin in gum tissue, just like there's natural melanin in skin. So
Mhm.
your skin color is a different skin color than mine because you have a different amount of melanin than I have in my skin. So gums are the same way. There's a different amount of melanin in gums also. So it might be that your gum tissue is going to look different than my gum tissue just because we're different. We have different cells. So some of the darkening is a natural thing. It's just melanin in the tissue itself.
Mhm.
However, there's a couple of reasons that you could see changes in the gum that are not natural and are not just genetic. One is infection. So infection in the gums, you're often going to notice a change. The gums are going to be more red, and often over root canal teeth, especially, the gums are going to almost be a purpley black hue. So you're
Mhm.
going to kind of see a purpley black look almost over top of that root canal. And it's because the root canal is dead. It's a dead tooth. And you're seeing the dead tooth through the gums. So those are two reasons you're going to see reddening, usually infection. Darkening is often a dead tooth. There's another thing that can cause darkening in the gums, and that is something called an amalgam tattoo. What that is when they're removing an old mercury filling. I don't even call them amalgam fillings anymore. I'm talking about the same thing when we talk about that. If you can call them an amalgam filling, a silver filling. I call them a mercury filling because they're 50% mercury, just so you know. Always have been, always will be. They're 50% mercury. So I call them mercury fillings. When a mercury filling is removed, if it's not removed safely, some of those little pieces of the filling actually embed in the gum and they cause a tattoo in the gum. So that is mercury material embedded in your gum. When you see, it looks like a tattoo, like it's kind of a grayish looking thing on the gum. And that is actually mercury or metal little particles embedded in the tissue. So that's another thing that can cause that. There are some autoimmune issues that will show up in the mouth that will sometimes cause lightening of the gums. I believe they're hugely fungal related or immunity related. And then we always look for the infection.
Right.
If we're finding out.
So if a person has had a root canal and is there any recourse that they have post, root canal? Is there anything that they could do about it once they've had root canals?
Remove the tooth.
You just remove the tooth. Yeah.
Yeah. And I wish I had an answer. I tell people every single day, if I had an answer to this, I'd be a billionaire, because there are so many people right now who need to have the root canal rehabbed, but it's a dead organ. Teeth are organs. It's a dead organ. So would you leave, when your appendix dies, do you leave it there? No, we get it out rapidly, right? Because it's going to gangrene. It's going to infect, if you have a dead, if a toe that's gangrene, do you leave it there? No, it's removed immediately because that's going to spread. This is a dead organ. Right. And once you have a dead organ, there's dead tissue in that. And the body, the bacteria always find the dead stuff. Always. So they remove it and replace it.
Part of life, right? when you're dead and buried, it's bacteria that immediately gets to that dead tissue. Yeah. And so what can you say about crowns?
So crowns, there's two different kinds of crowns. There's full porcelain crowns, and then there's crowns that have metal underneath. They're called PFM, porcelain fused to metal. That's what that stands for, if you've ever heard that. The metal underneath the crown is going to be an alloy. So an alloy means a combination of metals. So it's going to have gold, silver, platinum, palladium. Sometimes they have nickel, and a lot of women are actually sensitive to nickel. They show up by earrings. You can't wear earrings, cheap earrings, because they have nickel in them. So if you have metal under a crown, you're going to see often kind of a gray line around the gum line. That's that little metal core underneath. That is difficult to know. Is there mercury under there? Is there nickel in there? We don't know. So those crowns may be problematic just from the metal standpoint. Why did you need a crown? Again, you never need a crown. Right. But why was the crown diagnosed or treatment plan for you? Right. Usually it's because there's a lot of destruction that's happened to the tooth. You had a big cavity that turned into a big filling that fell out or broke, and you needed another bigger filling, and there's just not enough tooth to hold it in anymore. So usually a crown is the thing that's put on the tooth to hold it together. Crowns are okay, particularly if they're all porcelain. They're okay. I prefer you don't have one. But if the tooth can't support the filling that's in it anymore and will break if it doesn't have that porcelain covering, then I recommend a crown on top of it. I do something called an onlay a lot more often, though.
It's called a what?
Onlay.
Okay.
So a crown, if you think about it, it's like a hat. It goes all the way, all the way around, all the way to the gum line. To do a crown, you actually have to remove all the enamel on the tooth, every bit of it. Well, that's all the insulation of the tooth. And sometimes the procedure of the crown itself can cause a tooth to die because it's traumatic. So they remove all the enamel to make room for the porcelain or whatever's going on top. So I thought, well, why do we do that? Why are we making room for something? Why don't we just leave whatever is good and then just cover over what's not? So an onlay is a combination between a filling and a crown. It's still a porcelain covering, but we don't make it go all the way to the gum line. We don't remove any good tooth structure that could stay. We just cover over what needs to be supported and leave all the rest of the good enamel there. And that's what we do probably 90% of the time, is an onlay instead of a crown. Usually the only time we do a crown is if we're replacing an old one, because once a crown, always a crown. But if we can save any good enamel, it's going to allow for nutrient uptake through the tooth. It's going to allow for better cleaning. It's going to allow for a lot of things. If we can leave the enamel on the tooth is going to be healthier.
Yeah, that makes so much more sense. Because you're looking at the long term,
Yep.
here, and not just acutely repairing a situation. And I feel that that's what's missing when we're treating people, not just in dentistry, but also, as a physician.
Yeah.
We're not looking at the long-term effects of medications over time to the body, the risks that it causes, and the kinds of conditions that people are set up for just by taking medications. I just want to let the audience know that the author of the book that you mentioned, Hidden Epidemic, is Thomas Levy.
Levy. Yep.
And the title of the book, the full title of the book is Hidden Epidemic: Silent Oral Infections Cause Most Heart Attacks and Breast Cancers. So that's a pretty heavy title right there.
Yep.
That's pretty...
And like I said, he wouldn't say it if there wasn't science to back it.
Exactly. So what do you, first of all, do you fill fillings? Do you do fillings, fill cavities?
We do, because cavities are still here. People show up with them every single day, so we have to do something with them.
Right.
Absolutely. So we use a resin material, but we do a couple of things along with that. So the biggest problem with fillings, well, there's two problems. Number one, if they're not done correctly, they will leak over time, and then you get cavity underneath a leaky filling. Or number two, they didn't remove all the cavity underneath it to begin with, so you get a new cavity underneath it, and you have to get a new, bigger filling, which just leads to this life cycle of new, bigger filling. Sometimes that's going to break, then an onlay, then so we don't want to set it into this downward spiral.
Right.
So we use ozone underneath the filling, and all ozone is 3 molecules of oxygen, but it will kill any bacteria. So with this ozone treatment underneath the filling, we are making sure there's no cavity left underneath there. The other thing that we do is we have a laser that specifically will tell us how deep is the cavity. And if the cavity, so a tooth has 3 basic structures. There's the outside that you see. That's called enamel. You've heard that word before. Just underneath the enamel layer is called dentin. And then inside of the tooth is the nerve and the blood vessels. So the enamel is made of crystals, lots of crystals full of minerals. That's why they're white. That's why they're hard, because they're full of lots of crystals and minerals. The dentin layer underneath has a lot of tubes. That's where all the nutrient tubes are, nutrient channels, so that the nutrients can come up through the blood vessel in the middle and then go out to all the rest of the tooth through all those little tiny tubes. So when you have a cavity, if the cavity is just in the enamel layer, then it's lost minerals. That's how the cavity was able to crawl into those holes in the crystals, is because your tooth has lost minerals. Well, if that's the case, then we can add minerals back and do something called remineralization of teeth. So this is where people say, can you heal teeth? Oh, dentists say you can't heal teeth. You're not healing teeth, you're remineralizing them. Minerals were lost, we're going to put them back. So this laser I have shows me, is the cavity just in the enamel layer? And if it is, then I'm going to help you at home remineralize your tooth. There's going to be a protocol that you go through to be able to do that, to add minerals back. Once the cavity is progressed through the enamel and into the dentin, it's in all those little tubes. And so now it's going to spread. It's like a super highway inside of there. Now it's going to spread rapidly. Once it's at that place, at that level, we need to do some intervention. A dentist needs to intervene. We need to remove that cavity, stop the spread, use the ozone, kill all the bugs that are crawling in there, stop the spread, and fill it up so that it'll never get any bigger than that. So we always encourage and help with remineralization if it's possible. Not always possible, just based on the depth of the cavity. So if it's not possible, then we will do a filling.
Wow. And what do you use as the filling?
It's called resin. So it's
Mm,
a plastic glass mixture. It's
mm,
what most every dentist is going to use if they don't use a mercury filling.
right.
And they work well. They'll give you a lifespan of maybe about 10 years and then you replace them. We hope they last even longer than that. But if you have a cavity that's already spread, you need something to take care of it.
Yeah, so it sounds like that's obviously a safer option, but I was always curious about whether or not they have any issues with causing health problems over time as well. It sounds like that's a good long-term option if you have to
Yeah,
have them filled. Yeah. So
definitely.
yeah, so I know we're coming towards the end, and I am so enamored with everything that you're saying, and you're so spot on about your approach, and I'm totally resonate with everything that you're saying. And I'm sure that anybody who watches this episode will agree with me and will want to see a dentist just like you. And so is there an organization where people can find a dentist just like you in their backyard, in their neighborhood, if that's something that they want to do?
Yep. Have a few different recommendations, and you can put this in show notes. I can send this to you if you'd like. There are two organizations. One is called the IAOMT. Again, that's why you're going to want it written down.
Yeah,
Because
I'm familiar with that one. Yeah.
yep, the IAOMT.org. That one is the organization that I originally found about mercury. They have done a lot of research on two things, primarily mercury and fluoride. We didn't even talk about fluoride and
Mhm.
calcification of the pineal gland and all other health implications. And
Mhm.
anyway, that's a whole nother talk. But they've done all the original research on mercury and fluoride. They're very knowledgeable. So a dentist that's been through that organization will at least be up to date on mercury.
Mhm.
Now, are they going to be up to date on all the safe ways that we remove infected teeth and replace them with ceramic implants? Not necessarily, but more likely than just looking at your dentist that's next door. They're going to be more open to some of these concepts. There's another organization called the IABDM. It's basically the Biologic Dental Association.
Mhm.
They will also have more to say about the infected root canal teeth, the infections in the wisdom tooth areas, those kinds of things. So those are two organizations that have dentist finders on their websites that
Mhm.
you can go to and look and see if there's someone close to you. And then I offer a service. So pretty much every day, every patient day, I start with virtual consults, and it's from people all over the world. And what I do is I have you find a place to get a CT scan near you. And
Mhm.
you usually can find this at an oral surgeon's office, someone like that. We have those CT scans sent to us, and then I do a virtual, either a off camera where I record a video for you, or on camera live with you, reading of the CT scan. What that often does is it kickstarts the process for people, so they know, do I have an issue?
Right.
And then once you know, yes, I have an issue, then we guide to, okay, here's how you find someone close to home that takes care of that problem. Or some people come to us. We have a lot of travel patients that come because they say, listen, you can wipe out everything in a week. I just want to come and get it all done.
Right.
So we have both things that happen literally every single week. So those are ways we've tried to help,
That's
because it's hard.
It is,
Yep.
it is. It's very hard. What you're talking about is very foreign to a lot of people, which is why I've so wanted to have you on my show. So I'm so grateful to you for providing that service. That's awesome. Yeah. So I know we are, I don't know if there was something that you mentioned in our discussion about things that people can do at home to treat certain things. I don't know if we have time for that. If that's just a few minutes, I would love for you to just quickly dive into that, and then we'll end it from there.
Yep. So really the key to taking care of your dental health at home is, first of all, being aware of it. But also being aware of your nutrients. So minerals are key. Minerals are key for health. Minerals are key for tooth health, especially.
Mhm.
And gut health is largely related to that. If you're
Mhm.
not absorbing nutrients properly, you most likely aren't getting the nutrients to your teeth that you need as well, and it'll show up as cavities.
Mhm.
So that's really a first warning sign that something else is going on systemically in your gut. You're not absorbing properly. All of these, that's why I say the mouth is really a window that we should be looking through, because
Absolutely.
we can see. I can't see your bones, I can't see your stomach, I can't see these things, but I can see your mouth. And if
Mm.
I see cavities at the gum line in your mouth, it means your gut isn't working properly. If
Mm.
I see wear on the tips of your teeth, it means that your heart isn't working properly, or your heart and your breathing isn't working properly, which is probably a contributor to your high blood pressure. I mean, I can go through all of these things, the things that I see. So nutrients are huge. You need to add nutrients. And I'm just going to do this super quick fluoride talk. Basically, I don't recommend fluoride for multiple health reasons. What do you do instead? You replace what's missing. There is no fluoride in your tooth. So if you're using fluoride to strengthen your tooth, you're using something that your tooth never had to begin with. So we strengthen it with something called hydroxyapatite. It is the mineral that a tooth is made of. So I really recommend that you find a hydroxyapatite containing tooth product. I have a tooth powder that has it. There are other products online that you can find that are pastes. And that's the biggest thing you can do, honestly, for tooth health.
Awesome.
Gums, a big one is oil pulling. It's an old Ayurvedic technique where you actually put oil in the mouth, you swish it around for 15 minutes. People say, how the heck do you do it for that long? You just do it while you're doing something else, while you're showering, while you're doing the dishes, whatever. You're doing something else that, you're not really focusing on the swishing. But what does it do? It balances the biome in your mouth. It balances the bugs in your mouth. And it is one of the very best things you can do for gum health. So hydroxyapatite for your teeth, oil pulling for your gums. Those are two biggies. And then the third is go get a CT scan, a cone beam CT scan, and find out, do you have underlying hidden things that are affecting you, and get those taken care of.
Right.
And then my goal is that people just never have another cavity again. Like it's possible.
Awesome. And what do you think about probiotics for the mouth, or probiotics?
Probiotics are great. However, they're transitory, meaning they're going to come and go. So I recommend you get your gut, the gut biome going well. Oil pulling will maintain that, will help to establish that and maintain it. But a lot of times the bacteria in your mouth are there because of what you're feeding them. So the more sugar you feed them, the more carbohydrates, simple carbohydrates you're feeding them, the more virulent or the worse bugs you're going to have living there, because they love it. So if you back down on those foods that they love so much, often the mouth will fix itself from a biome and probiotic standpoint.
Absolutely. And the gut microbiome as well. When you back off on
They're the same bugs.
They exactly are. Absolutely. Absolutely. Wow. Dr. Jorgensen, I'm so grateful for everything that you have told us. It's like you just hit the nail on the head in so many areas. And I know that you are going to be providing a free download that you can share with my audience. And I'm going to provide how people can get in touch with you, because I know you're on the West Coast. But I'll still provide them, your website, Instagram, and Facebook account, so that they can, subscribe to you and everything that you do, and learn more from you, because you do teach. You're a great teacher. I love the way you talk about the immune system and how you have those soldiers on the ground, not just at the gut level, but also in your mouth. So you did a really wonderful job. I could just visually see how the tooth structure is in the way that you described it, and I think it just gives you a nice idea of what's going on on a microscopic level. Yeah, thank you so much. I really appreciate it. It's great having you.
Thank you. And if people want to find us, we're at totalcaredental.com. Like I said, we do virtual consultations with people from anywhere. And then if you just want to know a whole bunch of cool stuff, just check it out at Living Well with Dr. Michelle. That's where I do a lot of lifestyle pieces that people love. So thank you so much for having me. And I just want to help.
Yep, my pleasure. All right, take care.
Thank you.